I want to live the best life.
Welcome to the Dr Mol Show. Do your dentists ever lecture you about your heart health? They should. Research has shown that people who present with periodontal or gum disease are twice as likely to develop heart disease. In fact, experts are now saying that presenting with gingivitis is as strong a predictor of heart disease as high cholesterol is. We're not sure why, but we do know that looking after your gums can add years to your life, which is why I've asked Dirna to join us in studio, a passionate oral hygienist, to tell us just how to do that. Dirna, welcome.
Thank you for having me.
Absolute pleasure. 3 out of 4 South Africans battle with periodontal disease. What exactly is periodontal disease?
Well, you get gingivitis, gingiva meaning gum and itis meaning infection, like bronchitis, tonsillitis. So gingivitis is basically an infection of your gum. Totally reversible, maybe a little bit of bleeding when you floss, but that's about it. Where periodontitis is an infection not only of your gum, but of the surrounding tissue as well. And this can actually cause you to lose your teeth.
Yeah. You know, some symptoms of gum disease are often very subtle, but they can include things like bad breath or that bad taste you get in your mouth, red, swollen, tender gums, all sorts of things. Bleeding gums, as you talked about earlier, there you can see some of that on the screen. How do we avoid that? I mean, heart disease, we can prevent most of the causes of heart disease. We can do the same for oral health. How do we do that?
Basically, we want to prevent tartar from forming. So basically brushing twice a day for 2 minutes with the correct brush.
All right, let's talk about that, because we can get into all that. So brushing with a correct brush.
Yes.
Firstly, what's the correct brush? I mean, here's a manual brush.
Yes.
Who has electric? Who has manual? Electric. Electric and manual? Okay, so there's more manual than electric. What do you say about that?
Yeah. I prefer electric toothbrushes.
Okay. Why?
Because they already have the right action, so you just need to hold it on the area. Okay. And it's easier to reach more difficult teeth at the back and on the inside close to your tongue. So it's a lot easier.
Good. What else?
They've got timers on them, because most people don't brush long enough, and that's basically one of the biggest problems. Not really that you're not brushing correctly, but you're not brushing long enough.
And you said earlier 2 minutes, guys. 2 minutes. That's a long time to brush.
And when the timer goes off, then you realize how long 2 minutes really is.
That's true. Okay. All right. How hard? Because often I think brushing too hard can damage gums, can't it?
Absolutely. They will make your gums recede, and you'll find that your teeth actually start getting very sensitive. Okay. So the electric toothbrushes, most of them's got a little sensor in them, so if you press too hard, you can feel that the movement change, and then you know you must release the brush. The other really nice trick is not to hold the brush like this, but just to hold it between these 3 fingers, because then your grip isn't as tight, and then you won't be able to brush so hard.
Okay.
Yes.
Now you've got these funny looking teeth here. You're going to show us how to brush.
Okay.
This looks like I was going to say my grandmother's false teeth. It doesn't. I'm sorry, Graham. You know, that's just what a horrible thing to say.
Always start on the one side of your mouth. Don't brush here and there and everywhere. Start on the one side. Angle the brush. Let me show you here. Slightly towards the gum line at a 45-degree angle. And then do very small back and forth movements. Don't do long strokes, because then the brush, the bristles don't have time to go in between the teeth. Okay. If you either do small back and forth movements or like that, and then you'll see the bristles will be able to go lovely in between the teeth. Okay. All around this side, inside exactly the same. When you get to the front ones, always turn your brush up like that, and you do each 2 separately, and then the back ones you'll do the same as the front.
And keep a routine, I imagine. So you do the same thing every morning because you're used to doing that.
Yes.
You should replace your toothbrush when it begins to show wear, or every 3 months apparently, whichever comes first. Now some experts believe it's important to almost change your toothbrush even after you've had a cold, because the bristles can collect germs that can lead to reinfection. Wow. Yes. What about flossing? Now that's my big bugbear, man. I battle the floss. I use these picks actually. This is very handy, but apparently flossing and picking would be the best option.
Yes. If flossing stays your best way of cleaning in between the teeth, unfortunately, but there is other things that you can use to help you.
How many of our audience flosses, by the way, honestly? 1, 2, 3, 4. I'm glad I'm not the only one, man. I really battle the floss, you know. So
you're supposed to clean once a day in between. Okay? Whether you do it with floss or whatever, I really don't mind, as long as you clean with something in between your teeth.
Show me how to do that, because stick those gloves on and floss my teeth.
We'll do that.
Okay.
First of all, when you go to your hygienist, Ask her to help you to get the right floss.
Okay.
Your teeth, you'll see, is very close together, so we won't be able to get a thicker, more like a tape floss in between your teeth.
Right.
So make sure that you use the right floss first of all. Ask your hygienist to help you with that.
Okay.
So I'm going to use a thinner floss.
Because my teeth are close together. How cool is that?
You take a piece about 30 centimeters.
Okay.
This is the first mistake people make, is they wind the floss around the index fingers. You're supposed to wind the floss around your middle fingers.
Oh, all right.
Because now you have got 4 fingers left to maneuver the floss with.
That's fantastic. I learned something this morning.
Yes, and these ones then won't go blue as because you know they go blue off.
I call that ischemia, when there's just no more blood left in your finger and the pain and the agony. Yeah.
Okay, so the piece of floss that you use, keep it nice and short. Don't make it too long. This can also hurt you.
Okay.
Don't snap the floss down in between the teeth.
All right.
You put it in and go in with a sawing action until you pass that contact point. Okay? Then you're supposed to fold the floss around the one tooth. You slide it up and down. You go over the gum to the other side, up and down, and then you pull it out.
Which should take like all of 35 minutes in the mornings, eh? I mean, that's my problem. It just takes a little bit of time.
Okay, well, once you get the hang of it.
Let's get the feeling.
Okay, let's see.
All right.
One hand.
And if anything comes up between the teeth, don't tell anyone. All right, just keep it between you and I. There you go.
Okay. One hand inside the mouth, other one on the outside. You go in with the sawing action, fold the floss. You go gently up and down like that, and you'll see you'll be able to go in a little bit under the gum without hurting yourself.
Yeah.
Go over to this side, and you do exactly the same when you pull it out.
No bleeding?
No bleeding, well done.
Dirna, thank you very much. I am going to try to floss more, and I hope you guys try to floss more as well. What about mouthwash? That's easily done. That's a kind of a 10-second little rinse. Is that good?
It is good, but it's an extra. The most important thing is to remove your plaque manually. You cannot remove plaque by rinsing.
Okay.
That's very important, because people think if they don't floss, they can just rinse and it will be the same. It isn't. You still need to remove the plaque and then follow up with a mouth rinse.
And a tongue brush?
Yes.
I mean, this is a tongue scraper and this is a tongue brush. Eh? Tell me about that. That's fascinating.
Yeah. All the bacteria that's on your teeth and your mouth will collect on your tongue as well. Okay? A lot of us struggle with that post-nasal drip and all of that. So it's a good thing to clean your tongue as well. When you clean, I like a smooth scraper. I prefer the smooth scraper like this. Just scrape the front part. Look, it's not something that you'll do if there's somebody else in the bathroom.
Ah, you see, okay. All right.
Then
you're not going to scrape my tongue in other
No,
words,
I don't think I'm going to do that.
Good.
Then you'll scrape the back on the sides and then actually stick your tongue out and breathe out. Then your tongue's going to lie flat in your mouth floor, and then you go as far back as you can and bring it forward.
Without
and that's
throwing up. Okay.
Yeah.
Gagging, I mean.
You do desensitize after a while after doing it.
And this looks like some this is an air pick, is it?
Yes, that is a wonderful new thing. It's new on the market. It's called the air flosser.
Okay, well, if we still need an audience to get, half our audience needs to get the electric toothbrushes, I think that's probably another phase, the next step, as it were.
Yeah.
All right. So there you go. In summary, if you can prevent gum disease by essentially brushing twice a day for at least 2 minutes, flossing once a day. Michael, speaking to myself there, use an antiseptic mouthwash or toothpaste. Getting regular checkups and cleanings. Obviously, no smoking, good healthy food. We know all about that. How often should we see a dental specialist in closing?
Cleaning's done at least twice a year,
okay,
and a good checkup once a year by a dentist.
All right. I'm not even going to ask if our audience does that. You know, I try to do that. Who knew that your toothbrush was a weapon against heart disease? Hey? Taking care of your teeth and gums won't only maintain a great smile, it can also decrease your risk of heart disease. So be vigilant. You won't ever feel your arteries hardening or your cholesterol rising, but you might notice bleeding or painful gums. All the more reason to spend a couple of extra minutes in the bathroom.
For more information, visit thinkred.co.za.
I want to live the best life.